Dr. Kertesz, I mean, Thai people have been patting themselves in the back. We are doing a good job in containing the virus, right? Of course, judging from praises, good words we have been hearing from many other countries. So we would like to hear from you, I mean, someone who is neutral. How do you see, I mean, Thailand's handle the way they have been handling the pandemic so far?
Yeah, I think it's true. For weeks now, we've seen a leveling off of cases in Thailand, even a decrease in recent weeks. And I think this has been in large part due to the physical distancing measures that we've lived, the lockdowns, the shutdowns, the slowdowns. These have really served to create physical distance between people. And I think this has been very effective in slowing transmission. I think if we have a concern, it's really everybody's concern. And that's as we ease these measures, we'll need to keep in mind one of the lessons we've learned from this virus, and that is its very explosive potential. We've seen countries that were thought to have had the virus under control, such as Singapore and Japan, now experiencing very dramatic outbreaks of the virus. So we should never underestimate the danger that this virus poses. I think that's why the government's approach of a gradual phased lifting of restrictions is a good one. I think it's the right moment. We recognize that there has been significant hardship related to these measures. We've seen it all over the world, and it's normal that people should want to get back to earning their livings, but we have to be very, very careful. We have to be very cautious. It has to be done in a phased, strategic way.
And Dr. Kertesz, right now, Thailand is planning to have second phase of easing restriction probably on 7th of May. Do you think the timing is about right, or how do you think?
Yeah, I think the idea of phasing the lifting of the restrictions is a good one, and the idea of doing it every 2 weeks is not it's not an arbitrary decision. 2 weeks really represents the incubation period of the virus. So if we ease one set of restrictions, and we're strategic about easing one set of restrictions, we wait 2 weeks to see if there's an impact, to see if easing those restrictions has created a situation where we're seeing increased transmission of the virus. We wait for the 2 weeks. If we don't see it in the 2 weeks, go ahead and move to the second phase. And I think this, again, is a phased and strategic approach, and I think it's the right one.
Yes. Dr. Kertesz, Thailand has been reporting a single-digit new figure of new infection cases for the past many days now. So when you look at see the figures, how I mean, do you have any question about these figures? Do you think the figures that you have been hearing are reliable? Or do you have any question about them?
I think the figures are reliable. I think these are. I think what we're seeing is a good reflection of what is going on in the community. You know, we talk a lot about testing. Maybe I can just say a little bit about testing. When we talk about testing, it's not about testing for testing's sake to achieve a number or a target. It's about adopting testing strategies that will best find cases of COVID so that action will can be taken. And testing is most effective when the health system has the capacity to then rapidly isolate and treat those cases that are positive and trace and monitor their contacts. And we're fortunate that Thailand has this capacity. Isolating cases and their contacts prevents onward transmission of the virus. I think this is one of the things that Thai authorities have been doing very, very well, and I think is one of the reasons why we believe that case numbers have been contained.
And at this point, what should Thailand be careful of, like trying to prevent second wave of coronavirus pandemic in Thailand?
Yeah, it's a very good question. I think we all have to realize that at this time we have no magic bullet to stop this virus. It will be with us until we can develop a vaccine or a drug that can prevent or reduce severity of the disease. It's very difficult to predict when there will be a second wave in Thailand or anywhere for that matter. I think what we can be sure of, though, is that a second wave or a new outbreak of COVID-19 in Thailand, whether it comes or how severe it comes, is in large part in our hands, and it will continue to depend on the continuing great work of the public health teams in identifying and isolating cases, that work that I talked about, tracing contacts. But most importantly, it will depend on the efforts of all of us in this country to follow the basic measures that we know work. And these are the measures that we talk about all the time: the hand washing, the respiratory etiquette, the proper sneezing and coughing, avoiding touching your face, your eyes, your nose, your mouth, and most importantly, attempting in our lives to keep a physical distance of between 1 and 2 meters between us and those around us. These 4 basic measures are so effective, and they're so important in protecting ourselves and those around us from COVID and preventing transmission of the disease in our communities. We can remember to do these things, we can reduce the chances of a second wave.
Mr. Kertesz, the European countries have been successful with this pledging conference a few days ago. They were able to raise billions of euros to help finance research into vaccine and to help poorer countries deal with the situation. So I'm sure that the World Health Organization certainly would want to see other countries in this region follow in the footsteps. So have any advice for countries in ASEAN, for example, maybe to follow what the European countries has done?
I think what you're referring to is this recent consortium that's been built called it's an initiative, a consortium of partners, global partners, agencies, and it's called the Access to COVID-19 Tools Accelerator, and it's really a commitment on behalf of on the part of a large number of partners and of agencies to do 2 things. And one is to accelerate the development of vaccines and therapeutics for COVID, because we know that that's really going to be, is very likely to be the thing that helps us get out of this pandemic situation. But it's also to ensure that there will be ultimately equitable access to any of these therapeutics and vaccines that are developed. This is really key. And I think this is one of the things that it's really, and I think these 2 things, they're being done at a global level. They can also be done at a regional level. It's really critical that countries share information, science, technologies, progress on development of vaccines and therapeutics at the sub-regional level. And I think it's also critical that that groups of countries, regional blocs, continue to advocate at a global level for equitable access to any therapeutics and vaccines that are developed. It's really critical that when these vaccines and therapeutics are developed, they're going to be available on the basis of need and not on the basis of any other criteria.
Dr. Kertesz, one of the crucial factors in Thailand that WHO identify as the very good case that brings success to Thailand is local health volunteers at the village level. Can you expand on that, and what should Thailand do more on this? How do you think?
Yeah, this is one of the things that was really, when I first came to Thailand, was really, really remarkable. I think village health volunteers are one of the elements of Thailand's primary healthcare system that make it extremely strong. There are over 1 million village volunteers who are in direct contact every day with the Thai population. And this is a tremendous resource at any time, but it is especially important in the context of COVID-19 and of this pandemic. I think volunteers can do many things, and I think what they're doing very well is educating the population about COVID, about what they should be looking out for, the signs and symptoms. This role in increasing health literacy, increasing the, providing information to the population, increasing their knowledge about COVID is really critical. Volunteers can also, and I understand they're doing this in Thailand, can also help to monitor individuals who've been put into quarantine or help to trace contacts. Again, this is very tedious, hard work, and village health volunteers have a role in tracing contacts to make sure that the chains of transmission ultimately are broken. This is really critical work. And I think the real advantage is that village health volunteers, they know that they're closest to the people. They know what's going on in villages. And they're very acutely aware of any unusual public health events. So if there's a cluster of COVID-like illness in a community, they would be quickly aware of it, and they would notify that to public health authorities so that they may react quickly. So I think the role of village health volunteers is really important. And I know this system is very highly developed in Thailand. And I think it will be really important as we progress and as we move through this pandemic and we learn lessons. It will be really important to document this. And I think it's a potential best practice for Thailand to show the world.
Dr. Kertesz, we had you on our program more than a month ago. Are there anything new about the virus that you know today that you did not know a month ago?
Wow. Yes. Well, I think there's a lot of people working on this. I think yes, I think we're learning more about it. We're learning more about the role of the virus in causing symptoms. We're learning more about the role of asymptomatic people in transmitting the virus. We know, for example, that now that it's quite possible that people are capable of transmitting the virus even before they develop symptoms, and that was something that we didn't know previously. So we're learning about the transmissibility of the virus, and we're using that information to help with our efforts to trace contacts and help to advise individuals on how to protect themselves. We're also learning a lot about as rapid diagnostic tests are becoming available, we're learning a lot about immune responses to the virus. That is, people's individual bodily responses to the virus, their capacity to make antibodies. And we're learning more and more about whether or not and how this antibody response confers immunity. There's still a lot that we don't know, and we don't know yet whether antibody levels are good predictors of immunity, but it's something that is now being researched, and we should have more information about soon. I think there's a lot that we're learning. We have over 100 candidate vaccines now in the pipeline. We didn't have that a month ago. I understand some of those have now gone to testing in humans. So work on vaccines is advanced, and we're learning a little bit about some of the therapeutics that have been used. We've learned that hydroxychloroquine probably is not the miracle drug that we thought it might have been, and we're learning that drugs such as remdesivir might have, which you might have heard of, might have an impact at least in reducing the length of illness and potentially hospitalization, and this could be significant. So we're learning more about this virus every day. There's a lot of people working on it.
Yeah, it means that we know a lot about this virus, but the only thing that we need to know now is how to stop it, right? That's the only thing we don't know about yet.
That's true, yeah.
And what about the number of testing, Dr. Kertesz? Because right now, the Thai authority aims at having double the number of the testing to reach about 6,000 per 1 million population. Is that about right in terms of proportion?
So I think, as I said before, that it's not necessarily about testing for testing's sake or testing up to a number. It's testing to find cases of COVID so you can take action. And the action is, again, this isolating cases, identifying their contacts and monitoring and tracing contacts. And I think this is something that Thailand does very successfully. That having been said, Thailand has increased the number of laboratories that are doing COVID testing. And currently, authorities are doing widespread testing of individuals who present with signs and symptoms of COVID at hospitals and peripheral health centers. And I think I understand that in addition, and recently, authorities have adopted a strategy of more widespread testing in certain situations and groups which we might expect to be at high risk of COVID because of the conditions in which they live and work. Prison inmates, those who live and work in crowded conditions, health workers, and migrant workers and their families. We've seen outbreaks of COVID occur in these populations in other countries, and it's important that we monitor them closely. to protect them from COVID and to protect them and others from COVID.
Dr. Kertesz, as we all know, there are some people out there who are trying to hold certain country responsible and accountable for the pandemic. But as far as you know, is there any reference in history that a country could be held accountable for happening to be in origin of an outbreak?
Yeah, I think this is something that we try to avoid. It's part of efforts to avoid stigmatization of any one group or any one country. I think it's really, and I think this is one of the reasons why when we name this virus, when we name any virus, we generally don't name it after the place where it originated. It's not the fault of the place that where the virus originated, and that's why we adopt this convention of naming the virus. I think it's really important that we focus now on answering some of the unknown questions about this virus that will help us respond, and as you said, help us learn more so that we can get out of this situation. I think it's really important to focus on going forward so that we can exit from this pandemic as quickly as possible.
And overall figure of infection right now around the world is 3.8 million, Dr. Kertesz. When do you think it's gonna end this cycle of infection? Are we going to reach the end anytime soon?
Wow, that's sort of a loaded question. And I think, I think we're really, again, the thing that it's really the possibility, the hope of a vaccine or a therapy that can prevent or reduce the severity of this disease that will help us bring an end to the pandemic. And I think that's probably 12 to 18 months away at the earliest. So I think that we're really going to be working with the weapons that we have. It doesn't mean that we're helpless against COVID-19 at the present time. We have to work with the weapons we have. And that's the great work of health authorities to test, to isolate cases, monitor and trace contacts. It's what we all can do, all people living in Thailand, to prevent infections for ourselves and those around us. It's the hand washing, it's the avoiding touching your face, it's the respiratory etiquette, and it's the physical distancing. And it's also these lockdowns, slowdowns, and shutdowns, which through their imposition of physical distancing go a long way to reducing transmission of the virus. So these are the three strategies that we have, and it's going to be finding a balance. It's going to be the application of these three strategies, which will help us slow transmission of this virus while we're waiting for vaccines or drugs.
Dr. Kertesz, so far have you taken advantage of the easing of the shutdown restrictions yet?
I actually live and work in my office, so I'm here. I actually have not. So I'm pretty busy here. So with my colleagues at the Ministry of Health, so there isn't a lot of time.
Okay. All right.
Okay.
You didn't go
Thank
out.
you.
Haven't gone out for a meal or a haircut yet, right?
I'm waiting. It looks like it, and I'm waiting for you all to invite me. So as soon as this is over, we'll all go out for lunch.
All right.
Thank you for your hard work, and we really appreciate your time to join us tonight. Thank you very much.
Thank you.
Thank you so much.
สวัสดีค่ะ Thank you